Today marks a crucial step in the overall action plan for reducing the burden of vector-borne diseases in Guyana. Today before you, you see tools, but these are not just merely tools. This is the substantive commitment of the administration and the Ministry of Health to improving the collective efforts to prevent the spread of vector-borne diseases in Guyana. What we hope to date will do is cement the impact that we hope to have in reducing vector-borne diseases and ultimately contribute to the disease elimination plan that the Honorable Minister has spearheaded for the Ministry of Health.
One of the big problems that we have is to work to control vector-borne infections in Guyana. And for those vector-borne infections that we are focused on, we have placed a lot of emphasis on those transmitted by mosquitoes. And there are quite a number of diseases that are transmitted by mosquitoes. But if we attack the vector, which is the mosquito, then we can reduce all of these diseases. In Guyana, we would have seen in 2023, we had approximately 8,000 cases of dengue being diagnosed. And we have seen in 2024, those cases go up slightly to about 11,000. And already for the year, we have made about 62 diagnoses for the year. So we want to reduce the incidence of dengue in Guyana. We want to reduce the incidence of malaria and other vector-borne diseases. And we believe one way of doing this is to interrupt the cycle. And what you see before you here is ways and means of how we can interrupt that cycle. Because by killing the mosquito, by killing that vector, then we are preventing the transmission. We have had a lengthy discussion with the technical staff, and what you're seeing here today represents a 646 million Guyana dollars investment, both in terms of the equipment, these spraying machines that you have here, and of course these fogging machines that you see here. We also recognize if we are going to be using these types of machine, we have to equip the staff, properly attire them, so that the things that they're sending out, the mist that would be going out, that they're not affected by that. And so you see they have the helmets, they have the things for your ear, and more importantly, you have the mask, because these masks are intended to prevent the person who is spraying from getting sick. We are distributing the equipment to every region of our country, and we are training the people in every region of our country. And we'll be working with the NDCs, the municipalities, so that they would have the capacity to do this. By training them, their staff at the NDC and municipality, by giving them the equipment, giving them the protective gear, giving them the chemicals, because when these chemicals run out too, we'll continue to supply them with the chemicals. And our staff in the ministry would be not just doing the training, but from time to time would be doing the oversight. So we intend that as we do this and building this capacity, we'll be able to do multiple regions at the same time. And therefore, for this year, we don't anticipate that once we do this properly, that we'll have too many mosquitoes, and therefore we should see a significant drop in the cases that we have been diagnosing.
Now you have to take ownership of these things, and bottom line is, it is the people who have got the benefit. These equipment will be handed over to you. Make sure that you utilize them properly, but more importantly, you take care of them. There's not chicken feed money. There's a lot of money that's invested here. You have to take care of them. You have to service them. You will be held accountable. You'll be given adequate amounts. Minister sat down, spent his time with the experts to calculate how much of what you need. It has been calculated. We want you to make it work. On behalf of the regions, I'm telling you, Minister, we are going to make this work, but the regions, the RHOs, you have got a responsibility to ensure that we get the full lifespan out of these pieces of equipment.
We are so grateful for these additional appliances or equipment which will serve in the aspect of vector control activities, and we will urge that the various departments will use them in terms of decreasing the incidence of infectious disease, more so the arthropod transmitting diseases. And of course, we'll extend that to the NDCs where we have a better control plan, and of course, we'll ultimately see the eradication of such. I was guided that there is a series of vehicle-mounted fogging machines, some 57 plus. There's quite a lot of swing fogging machines, and of course, chemicals to support that. We also are pleased and thankful for the initiative of fuel and lubes being provided to the 10 administrative regions, and that will aid the process. The personnel aspect will be supported by not just the Department of Health, also will have the NDCs playing a pivotal role, and for the indigenous communities, the village councils and Tushaus as well will play a pivotal role. I'm optimistic, everyone will be optimistic at the end of this, that these equipment will be able to serve our country as a whole, and we'll see some positive curve in terms of disease elimination plan.